So we already know about, for example, the incidence and the mortality rates. So you can, find this information on the ACS, the American Cancer Society, or the NCI, National Cancer Institute, about the mortality rates. They're anywhere from 2 to 2.4 times higher compared to men of other racial and ethnic backgrounds. Also, you're looking at about 60 to 70% incidence rate, which means they are 60 to 70% more likely to be diagnosed with aggressive forms of prostate cancer. So we're talking about Black or African American men or African descent men that also get prostate cancer more and die from it more.
This is the Real Health Black Men podcast, where we empower men to take control of their health. We provide vital information and build community support. Join us as we discuss everything from major health challenges to mental wellness to physical fitness. So if you're ready to level up your health and your life, you're in the right place. Let's get started. So welcome back to Real Health Black Men. Thank you for listening. Thank you for your support. Today we're discussing a topic which is very dear to my heart. It's an organization called BACPAC, and I have some friends with me who are going to help us understand who BACPAC is, what we do, why we exist, and how you can get involved. So today my guests are Dante Moorhead, Ben Young, and Dr. Jan Naami. You've heard from Dr. Naami on our previous episode about your men's urologic health, and you may hear some more from him today. But today we're going to focus mostly on Dante and Ben telling us the story about BACPAC. So, gentlemen, welcome.
Yeah, thanks for having us.
Let's begin by saying what BACPAC is, and then having you to introduce yourself. So who wants to tell us what BACPAC means?
Go ahead, Ben.
Go ahead, Ben.
I was hoping that it was Dante. but BACPAC is an organization that started. There were a lot of starts. I would say that there were a lot of starts. As far as I know of, I was doing some social justice work up in Snohomish County, Washington. And someone or somehow I got connected to Dante Moorhead, who was at the time working for Fred Hutch, doing some field work or outreach work. Long story short, I didn't get any direct funding from him, but he invited me to something else. And on how to write a grant. I didn't really know exactly what I was getting into, but I went nonetheless. And I was partnered with Dr. John Gore as my, I can't remember what the term was that they called it, but he was my...
Yeah. I think they paired us with like grant mentees or writing mentees or at the time.
And it was interesting conversation because it was on prostate cancer. And I don't believe at that time that I had explained to anyone that I had just gone through prostate cancer myself, a prostatectomy myself, a partial prostatectomy. And so it was new, fresh, but it was something that I was definitely interested in because I knew that I couldn't be the only one. And that it was such a mystery too, because all I was seeing was the medical side of it. And as it related directly to me, as opposed to relating to the community.
So you guys came up with the name of BACPAC, Black and African Descent Collaborative for Prostate Cancer Action. How'd you arrive at that name?
Well, go ahead.
Go
Why
ahead.
that name? Why that name?
It's a group discussion.
Mm-hmm. Yeah, it was a group discussion. So for those, okay, so how it came about from how I remember it, and you can correct me if I'm wrong here, but for those who know Yao, he's big on acronyms. Like whenever he's doing a project, he'll come up with these like marketing names and acronyms for something, and then it'll be like STAR or this and that and third. And so we're having a group discussion about names, and we came up with a different couple. And then he uttered this phrase like the Black and African descent for, he was thinking that out in his head. And so, and him and his cool acronym names. And then as he's doing that, I remember Jenny was like BACPAC. Shout out to Jenny Lee. And she was like BACPAC. And then I just remember I was like, yeah, how about backpack? Like a backpack. And at that point I was like, yeah, because we can have brothers walking around with backpacks and it's a good look, you know. And I still have my backpack. We got that swag. But that's how the name came around, because he was thinking of yet another acronym and these long phrases. And then we kind of stretched it or shortened it, to backpack. And so that's where it came from, the Black and African Descent Collaborative for Prostate Cancer Action Network. Yeah. And then kind of put it together. And so that's how I remember it. And my memory is pretty accurate. So I think that's how it came out.
Obviously the name is not an easy one to remember, but everyone remembers backpack. And I think that's something that's important. You know, I think the naming of things comes from my time in business school and marketing. You know, like I went to I got a degree at a school that really was known for branding. And one of the things you realize was, you know, brands are useful in so many ways, right? They help with communication. One of the things that I love about a good brand is it brings the team together. You know, it's like, yeah, if you don't have a team name, like, what do you call yourselves, right? Are you really a team? Yeah, that's true even when you're kids, right? When you're young, you know, you might go shirts, no shirts. I remember back in the day that all of a sudden people were like, all right, we're the Bulls or whatever, you know, because you wanted that identity. And then you think about how strong a brand like even the Bulls brand at that time in the 90s was. Everyone wanted to identify with it. So yeah, who knows who came up with the name Backpack? We give Jenny credit because I really do think she is the one who put it all together. I think that we worked towards the name back in a backwards fashion too, in that we decided that we wanted to use Backpack as the acronym, and then we were able to work towards a name that would fit that acronym. And Dante was responsible for that. Dante really wanted us to have backpacks. He was like, yeah, we're going to wear them around. So then that became kind of a thing, which is, as you know, Grantley, now, every event we've got some extra backpacks that we're giving to new people, members and people who show up, to hold all their stuff together. And I think symbolically, Dante said this, right? It's like where you hold all of your valuables, your knowledge. And so we felt like, you know, symbolically, the backpack organization was going to hold all the things that were important to us with regards to addressing the needs of Black men who had prostate cancer.
So what is the purpose of Backpack? What is the purpose of Backpack that you came up with?
I'm going to answer this, and then I'm going to step back and let these two gentlemen talk. I think the purpose has changed. You know, originally Backpack for me was an opportunity to bring Black prostate cancer patients together to help us do better research as an institution here at the university. But we've grown a lot since 2020. We're a much different group, and I think we serve different purposes now. But the mission was simple when we started, you know, make Black voices part of the prostate cancer research ecosystem, if you will. It just was a missing voice, and we would be talking about disparities in prostate cancer, and there wouldn't be a single Black patient around to even share a little bit about their journey and experience. And so it made a lot of sense to me to create space to hand power to community, but more, and handing power to community is really important. But I think handing power and giving space to patients, right? It's one thing to be Black in America, but it's another thing to be Black and have an illness or a chronic disease that you're managing. That's a very unique experience. And I felt that BACPAC was going to allow us to let people get into that room, arm them with the information to have their opinions, be heard, and influence, the way that we did research, because research is how we make things better, in my opinion. So anyways, that's BACPAC to me. I'm really curious to hear what BACPAC means to Ben and Dante, because I think they've been there from the beginning and they've seen this thing change in a pretty significant way.
There are lots of changes happening in the world today. It's troubling the way that science is being replaced by political ideology and myths. We as people of color don't have the luxury of being victims of ideological debates. There's over 50 years of evidence of the disparities in health outcomes and healthcare quality for people in our communities, and death is irreversible. We know that science wins, so we have to, now more than ever, seek out credible voices, competent medical professionals, and grounded research, because our lives depend on it. We need to take control of our health and of our health care, and we need to become our own advocates. This podcast will do its part, and there are other credible sources out there for you to turn to. So let's not get weary or complacent, because your life matters. Well, thank you for that, Dr. Naomi. So before we move into what BACPAC means to Ben and Dante, why don't we have you guys introduce yourselves? Tell us who you are, what you do, and maybe your role in BACPAC as well. So who you are, what you do, and your role in BACPAC. Go ahead, Ben.
I am a community activist at best. It's a lifetime. I've done other things for pay, as some of you may know, that community activism is not a very high-paying job. Most of the time, starts off as a volunteer, and through that, it's a lot of difficult work, and sometimes true community activists, they are bouncing their head against the wall. One of the things that stood out for me when this originally started was some of the statistics that Dr. Niami said. And the biggest one, of course, was that half of there are so many deaths here in America with prostate cancer, and over half of them are Black. But there's only 3% of research and science that were associated using Black people or Black men. And that got me to really going to say that we have got to do our part. We can't be dependent upon someone else doing something. And it is that community activism that got me riled up and tried to get a other folks in the community motivated to want to rally behind this and do something. And that first something, of course, as it continues to be, is early detection. How do we get more people from the community involved in the early detection? And it's interesting. I thought that I knew the answers to that, and then I realized that, sometimes, every now and then, I'm not the smartest person in the room. Every now and then. And so I listened and I heard, and very enlightened, and that's where I'm at with BACPAC. How it's kind of evolved into what it is now.
Thank you, Dante.
Yeah. Let's see who I am and what I do. Those are like two different things. So I'm a PhD student, University of Washington, community health educator, cancer health equity researcher, and a graduate research assistant with BACPAC at the University of Washington. I know we had this conversation earlier. I've been with them for about 4 years or so at this point. Living here in Seattle, originally from North Carolina, from Chicago. From where I'm from, we like to say NC by way of Chicago. And I think that Ben gets it. So that's kind of my dad. And I think I know that my identity as a Black or African-American male is important to me, and it's interacts with my future work and my research. And so the work we do at BACPAC, it kind of speaks on that. I look to like blend research with social justice and activism and community organization and advocacy. And so that's a little bit of me. Former semi-pro athlete, I can claim that, in soccer. That's pretty much me in a nutshell. Yeah.
Are you excited for 2026 in Seattle?
Oh yeah.
World Cup.
It's funny you say that. Hopefully, I think it's going to be way more traffic than we need, but I'm super excited. I know my partner, my wife, she's just like, she was rolling her eyes. She's like, we're not going to all these games. I'm like, all right, well, that's what you say.
All right.
So, yeah.
I tell people, when I came, I tell people all the time, I said, you think you know what being fanatical about sports is through football and basketball, but you have not seen what fanatical about sports is until you see soccer people show up.
Oh yeah,
for a World Cup game, right?
Oh yeah, it's
a different level of fanaticism.
Different level. I've seen Barcelona play in Barcelona twice, and like I was there when Messi scored his 400th career goal.
Wow.
Yeah. So anyway, we got off topic, but yeah, that's
we got off topic.
Yeah, we got off topic. We sure, but yeah, that's me. That's who I am, and that's kind of what I do. And I'm glad to be kind of nested in coming from an organization that did that, and then being nested in this organization under the mentorship of some great people who are kind of helping me along the way.
So you said you research in health disparities. And one of the things that is in the purpose of BACPAC on the website is, we say that through research, we seek to find out why prostate cancer disparities exist and use that knowledge to improve the health of men in our community. So just give us a little taste about what are some of the disparities that you are aware of or that you're researching as a PhD student that might be pertinent to this conversation.
Yeah. So, there's tons. So we already know about, for example, the incidence and the mortality rates. So you can, find this information on the ACS, the American Cancer Society, or the NCI, National Cancer Institute, about the mortality rates. They're anywhere from 2 to 2.4 times higher compared to men of other racial and ethnic backgrounds. Also, you're looking at about 60 to 70% incidence rate, which means they are 60 to 70% more likely to be diagnosed with aggressive forms of prostate cancer. So we're talking about Black or African American men or African descent men that also get prostate cancer more and die from it more. And those are the two important ones. And then we talk about early detection, for example. So the screening that's available to get screened. Prostate cancer is very treatable. So it's important that men get screened. So a lot of my research or work likes to focus on prevention and early detection. And so one of the things I do like to talk to men about this, about what works for them, what will get them into getting screened. And there's some disparities there. And if you just listen to their narratives and their experiences, you can learn a lot. So I do a lot of qualitative work because I like to talk. I like to interview men. I think their experiences and stories are very important. And so, for example, I learned that the DRE or the digital rectal exam is not very popular among Black men from a cultural contextual standpoint. So if we want them to get screened, instead of hustling that DRE, and they refer to it as Dr. Dre, that's what they call it, they don't want that. So one way to help them to get screened is to kind of push them towards other methods of screening that are simpler and more effective. And then we also know that there are some differences in surveillance and follow-up care post-treatment, for example, from biopsies or surgery or for radiation. That follow-up care looks different. So a lot of the things that I'm reading about and studying about, Yao and BACPAC and the team are, researching those things. And they're also getting these types of experiences and stories, from men, from partnerships, from communities of men, and things like that. And so when we look at early detection and screening, we look at, getting your PSA test. We look at your follow-up care after you've been diagnosed, after you've had surgery or radiation treatment, or even, for example, are providers giving you all the options, or are they just like, you need surgery? Or are they saying, oh, we're going to actively do active surveillance for you? Or do you need this? They're not getting all their options. They're not getting all their treatment options. They're not getting all the information. And there's not enough information that's readily available in the context of the Black or African American men when it comes to this, especially for aggressive forms, compared to that of, their white male counterparts. So these are some of the things that, I've come across, and there's tons of literature out there. Yao put me on a paper like a couple years ago by Emily Rikunsk. Forgive me if I butchered the name, where we learned that from these major trials that kind of looked at PSA testing. And then I also learned that as part of that, since like 1996 or 1990, I can't remember the date, but most of these trials that they collected data on how well PSA testing works, these samples were predominantly white men. So we don't necessarily have enough information on the population that's affected most by this disease burden compared to white men. You see what I'm saying? So all these things are relevant, and they point to like glaring disparities that exist for this particular disease. And so, and that's also important to my own identity as a Black man, as a Black male researcher. So not only does like the work at BACPAC check all the boxes for that, but I also consider it a very worthy cause, because this is a heavy disease burden for this certain population.
Thank you. It's an opportune time for us to be talking about this because, just recently our former president was diagnosed with aggressive prostate cancer. And even though he is white in that population, this is an opportunity for us to reinforce the messages that you just brought up about the importance for Black men to get tested and early screening, because we know the disparities are there.
Yeah, I want to say something about that just from the clinical standpoint. We have a really effective test for detecting cancers early in PSA, a blood test, right? You can add that on to any checkup, doctor's visit, where you're getting your cholesterol, your sugar and other things checked, how well your kidneys are working. we really scrutinize this test, and we've almost, in some ways, demonized it. And there are some populations that are very vulnerable as a result. So older patients, regardless of how fit they are more likely to be told they shouldn't get tested. And in the early work we did with Dante and Ben, we learned from Black men we interviewed that many times when they approached their doctors to say, I want to get a PSA test to get screened, they were being told, oh, don't worry about it. This cancer is not that serious. And for a cancer that's disproportionately killing Black men, right? And so I think the president's example is a powerful one, because here is the most powerful person in the country with access to everything, and who knows? I mean, I don't want to speculate, but who knows? But his age likely plays a factor into whether or not he gets this routine, what could be a routine test. I don't like to use examples of one to make strong arguments. That's not the right way to go about it. I mean, I think if we learn anything from what Black men are experiencing, from what we see in the president, we definitely need to critically reevaluate how we use this test, how we make it available to people that should have it and need it. And to be honest, that's been a big part of what BACPAC has been doing over the last year and a half, is re-envisioning how to test better, and also how to get testing into the hands of people in a way that won't harm them, but will allow them to maximize that benefit that you get from catching a cancer early.
You know, you said you don't like to do it one, so it's more than one, because the same thing happened to me when I first talked to my GP about getting my PSA tested. He tried to talk me out of it. In fact, he talked me out of it for a year, and asked me to look into some of the research. But I knew my family's history, and so I went back and I said, I want to have this test done, and I want to start monitoring it. So one of the things that we do on this podcast is we encourage men to take control of your health. You know, you're paying the bill, it's your insurance, it's your health. You're the one who's going to suffer with it. And sometimes you have to be a little bit more persuasive with your doctor to say, yeah, I understand that you may not think it was important right now, but I'd still like to do it. So then once we started tracking it, we saw my line. Every time I had a PSA test, the number went up from that very first time. Right. And then it started to go up faster. So the curve, it was just creeping. And then the last 3 tests, it just shut up. But if we weren't tracking it, I wouldn't have known that, and we wouldn't have, it was changing.
I had that done to me. Speaking to what you both talking on, I requested, when I asked for a PSA test about 3 years or so ago, I was kind of deterred from it as well. I know the information though, and what their assessment is kind of based on. But it's still an important test. Like, we need a tool to at least talk about prevention and to get screened. And so my hematologist oncologist was telling me, well, you know, you're fairly young. First of all, I was 40. And then he was saying, well, this test, you know, it's not really accurate and stuff like that. It just seemed like the whole conversation was kind of deterring me from getting it. And so I kind of had to press for it. I was like, listen, you're already doing a blood draw, just add it on. I would like it, you know. So it's kind of taking charge of your own health and knowing the information. And given that I knew the information, and I wanted to tell him, man, do you know where I work? Like, give me the test, you know. I know what I'm talking about. Let me get the test. You don't know me. Like, give me the test. I know what I'm doing. So, but I got it, and I got my number then. And, you know, I have other health circumstances, but I thought it was important to have. So you're absolutely right when, you know, men should take, you know, control of their own health and know the information. And, you know, it's a good test, especially for, you know, it's important tests for Black men to know and to get started early, because most times they're not diagnosed until later ages. And by then it could have advanced as far as the stages. So
thank you.
I recognize a lot of the things that I went through. Being that now that I'm 70, there are a lot of health challenges that folks go through, and of course, I was going through, and I was actually being seen by a doctor or a GP on a pretty regular basis, and it just, so I actually am one of those that I may have dreaded it, but I had the annual DRE. It was just, I just looked at it as something that I had to have. The other thing, and it was at that point, it was actually a PA that did it. And, she said, I think you probably need a PSA test. And I was 61, and I was 61, and so I said, sure, why not? I haven't had one in about 2 years. Did it, and sure, it came back. My number was very elevated, and so I went to a urologist, and things just flew from there. And about 4 months later, I made that decision. But it is one that, when you're talking about men and their health, it is, you can go into the doctor for one thing, but there are many other things that you could also ask that doctor to check and test. And that's something that through BACPAC, we're able to get more people to be aware. Because I have been living in this area about 2.5 years, a little more than 2.5 years now, and still just getting to know my neighbors. And my neighbor stopped me. He was riding in the road, and the next thing I know, he was telling me about his prostate cancer treatment and what he was going through. And, and both of us are retired. And it's kind of amazing, because we sat there and we talked, but I have 6 people that I talk to in this little circle that I'm in. And out of that 6, 5 of us are 100% aware of prostate cancer. And it's probably because of so many in this area that are now seeing it and it is important for us. Dante, my point here is that Dante, when I was doing my study, or little survey that I was doing there in the community, Dante said that perhaps we need to go to younger men. And at first I thought, why? And then after he said it a couple of times, and very demonstrably, and I was appreciative of it, though. I was appreciative of it. It wasn't rude. He was just trying to make me understand that earlier that we get folks tested, or at least knowledgeable about it, the better off that we are. And that's what I'm seeing, is that based upon the surveys and studies that are coming out now, that this is important for us. It's important for us to take control of ourselves, and the only way of us taking control of ourselves is being knowledgeable about it. And our job, at least my job, is to go out and spread the word and make sure that people have that opportunity to at least seek the knowledge. Maybe not, because I can't tell someone all about prostate cancer, because that's not me. What I can tell you is the experience that I went through. And I know that everybody's experience is going to be a little different. And so I'm just so proud of the fact that I'm a part of something that is disseminating information constantly, and new information and current information on what's going on in the world of the prostate.
Thank you. That is a great transition to so the next part of our conversation is the work that BACPAC is doing and hopes to do. But before we get into that, I've got one more question just for clarification, and then we're going to get into the work. So, Dante, you work at Fred Hutch Cancer Institute, is that correct?
I used to. That's where, yeah.
Yeah.
Now
you're at the university.
Yeah, I'm at the university now, and I'm with BACPAC and at University of Washington Medical.
Yeah. Right. So you and Dr. Naomi are at the University of Washington.
Mm-hmm.
So the question is BACPAC a part of the Fred Hutch Cancer Institute? Is it part of the University of Washington? Or is it a standalone organization that's just affiliated with those organizations because of where we're located? I don't know who wants to take that. Who's the best person to answer that?
Oh man, I figured. So the truth is we don't know. I mean, nobody really understands what BACPAC is, right? If you ask some of the people in my department, they kind of talk about our research team as BACPAC, but and then obviously we who are involved in BACPAC know that it is a separate group of men. I think the vision and the dream is that it's standalone, that we have a powerful group of patients that can go to any researcher in the country and say, hey, you're not doing it right, or we can help you do it better. Right now, our research team gets to take advantage of that, every week. But I think that's the vision. So the answer to your question is, I think it's separating. It started out as a UW entity and very intertwined, but I think we're starting to have an appropriate separation so that the group can influence, advise, support independently without having to feel like they have to be representative of the UW or Fred Hutch, agenda, right? There's some freedom there if it's not a university entity. So I think that's important.
So what makes BACPAC different from other prostate cancer organizations? Is it the patient focus or is it the research focus? What would you say,
most
Dante?
obvious is the focus on Black people. I mean, there's a lot of organizations out there. Prostate cancer is common, y'all. I mean, we talked about this in our last podcast, but 1 in 8 men, 1 in 6 Black men, are going to be diagnosed in their lifetime. So it's very common. And so there's a lot of great organizations, Prostate Cancer Foundation, Zero. There's even an advocacy awareness education group called FIN that is started by Tom Farrington, a Black prostate cancer survivor, has done a lot of work. But I think, our focus on Black people was one differentiator. Then the second was a research. I think we didn't want to come together with the purpose of educating or getting the word out as our only focus. We wanted to help do the research that would make doctors and healthcare providers practice differently. And I got to say this. I said I would keep my words brief. That's never true.
Never.
This idea that we have to study why the disparities exist is wasted energy. We've known that's been reported on for a long time, right? So I think what we do that's different is we're studying how to make those disparities go away. That's different, right? So, we're doing all this work. We're having all these conversations. We're building towards studies that will prove that we can do better. In doing that, we're providing the ammunition, hopefully, for others to do the same. What do I mean by that? We spent a good chunk of our Wednesday evening meeting talking about we don't need to test whether or not people need social support. If you're doing a study and you want it to have more than 2% of the people be from a rural area or be Black, Latino, indigenous, then you got to provide the social support. That's got to be built in for anybody who wants to participate. So, philosophically, we take this approach that we're not going to spend a lot of energy and time trying to describe the things that have been true in healthcare in America for 50, 60, 100 years. We're really focused on how we overcome those things. And the group provides so much rich information, novel thoughts on how we approach that are, I really think, going to be game changers in 10, 15 years. You'll look back at the results of the studies this group is doing and say, wow, right? This was a turning point in how we approached cancer research in the U.S.
So we're going to get into the details now, and based on these two questions. What is the virtual research community, which is something that we talk about, which I think is unique to us? How does it work? And then then the second part of it is what specifically is some of the work that BACPAC is doing. We talk about the research that is happening and that kind of stuff, but I want to get into some of those specifically. So should we start with the work that BACPAC is doing and then come back to the virtual research community, or is the virtual research community a good springboard into the work that we're doing? Dante.
I guess we could talk about the work, and then the virtual research community, because that sort of advises a lot of the work.
Okay.
Okay.
So give us an overview of some of the specific work that BACPAC is doing right now.
Oh, wow. That is a whole separate show. Yeah.
Just give us the topic and maybe the focus.
I might want to give you that. It's his catalog is deep. Okay, all right, please stop me and correct me and jump in by any means. So there's multiple studies and projects going on, some that are current, some that are about to start. Currently, there's the STAR, which is focusing on secondary treatment after radical prostatectomy in Black men. So looking at follow-up care following your diagnosis and your prostatectomy. I'm currently doing interviews with patients for that as well, and we're looking at patterns of like outcomes for secondary treatment and post surveillance. Like, what are those differences in your post treatment experiences? And why do they matter? So that's one. Jump in at any time, explain more if you need to. Yeah. And then there's also the GEMS, again with these acronyms: germline, environmental, social, and something structural GEMS. And that's looking at like determinants of aggressive and lethal prostate cancer in Black men. And that's an important one because it's like building a cohort or a group of Black men to study biological factors of aggressive prostate cancer and looking at any like genetic mutations and forming a biorepository or like, collecting samples and tissue samples and things like that to look at these and to look at how it's affected. That's a really huge one, I think. And I'll let him speak more of that in a minute. And then there was EDAB, and I don't remember the acronym, but that's like multi-stakeholder engagement. That's also important. So organizing and creating equity around like prostate cancer outcomes, looking at early detection. So organizing these stakeholders and having actually Black men advise us on like solutions or to increase early detections. Like, how can we do screening tests better, strategies around PSA testing. It's very patient-centered and it's very patient-engaged. And so these men come together as advisors and they kind of identify any strategies in screening that are needed or early detection, and they kind of drive our research agenda. And then there's Combat PC, again, another acronym. But that one's about creating like a resource toolkit, and it's developed in like partnership with Black men who are trying to help create these resources along with providers. It gives you information on clinical trials. It gives you information on PSA testing, what tools could help raise awareness or what tools or resources you can be armed with during a clinical encounter to help you with your shared or informed decision making when you're talking about your health on the prostate care continuum. And then and there's the big one, and I'll let him speak to that, whereas we're trying to form like a cancer health equity hub or center that's kind of going to organize all of this work, where BACPAC is going to be housed in this, and developing different interventions and support, and also hosting like cancer center activities. So there's going to be community benefit grants. There's going to be, a organization helping push the work forward. It's even supporting like train the trainers or citizen scientists, or helping Black men to empower their own care, like training them to do some of the work and the research, and even hopefully an activity where we support future people or students who want to do that work and kind of develop and train the next group of prostate cancer health equity researchers, things like that. So that was like 4 or 5. I'm missing a ton. I'm just trying to give a big overview. Feel free to jump in, Yao. But those are the ones that come to mind that are current.
Yeah, that was a good summary. The way we look at it is, you can't affect this this big problem. Ben, said at the beginning that Black men are twice as likely to die from prostate cancer. I think Dante also alluded to that. 50% or so more likely to be diagnosed. So the burden is huge, right? And we calculated that burden. It's a lot of life lost due to prostate cancer. I think we talked about that in our last show. So when you have a complex problem like this, the engineer in me from way back when I was an engineering student feels that you solve complex problems at multiple points, right? You can't just go in the equation and move one particular small piece of it and expect the output to be different, right? You got to approach it at all in the ways that you can, and all the different points where it needs assistance. So we looked at the problem from start to finish, from diagnosis through treatment to death, and said, how can we alter death, right? And what we've learned in our conversations is that there are all these different points where we might let patients down, right? We might not be screening enough. We certainly don't understand why Black men are getting more cancer. We need to figure that one out. That's been true for a long time. Once people are at their decision point, we're not supporting them to get treated, right? And maybe then they get overwhelmed and they don't either don't get the right treatment, or they walk away from treatment when they should get it. And then once people are treated, are they getting supported, right? That's a whole nother journey. So that's why Dante's here describing all these different projects. They're kind of they're holding up and addressing all those different points. And what we've done is we've done our preliminary work, right? We kind of understand how we want to approach supporting those different arenas. That's what the last few years was just getting a lay of the land, or understanding the landscape. And I think the next 3-4 years is all going to be about action, which is going to be fun, right? It's getting people into trials and studies and seeing if the things that we think are going to be beneficial actually help, right? And to echo the words of Ben at a meeting from last year, we want our studies to help everybody, right? The goal is to make sure that if you get in a study that's a BACPAC study, that you come out the other end bettering yourself, your health in some way, rather than like really trying to say, okay, compared to doing nothing, or compared to what you might have experienced in your community, if you're lucky and the computer draws you to the BACPAC, deluxe package, you're going to do real well. And if you don't get the deluxe package, well, good luck. Like we're not really interested in that. So it's been fun. And that's helping us reinvent the way we think about how we're going to measure benefit too, right? That's what I mean by maybe in 10 to 15 years, we may have had a really positive impact on the field, because we may help people think about being more patient and community centered, and what we think is a meaningful benefit, right? Right now, benefit is just like less people die, right? But that's not good enough.
So, yeah, and the thing that I think about is as we solve these issues, as we get to better understand, why there's disparities in the Black community, why people are diagnosed more and more aggressive and more lethal, it also benefits the entire population as a whole, right? The entire medical community as a whole, because hopefully what we're coming up with are also things that can be used in other areas of the prostate cancer world. So Ben, what's your role in any of these studies? Are you involved in any of these studies? How do you fit into?
My involvement is more patient-centered, and has questions come up, or creation of some of the questions that are being asked in some of the surveys. My experience and roles within the community, and how folks talk to me. I once did was doing part of the survey, and I was sitting around. There must have been 10 guys, I think, and 10 Black men that were sitting around. And, I think I said it to you before we got started, how we're in this group. None of us had the code switch. And because none of us had the code switch, we got thoughts or answers or things that were said that we probably wouldn't say in any other type of group except for that. But because we were there and we were only focused on prostate cancer, and we had what do you thought real health, we were having real talk, and the real talk says that some of the things that we don't think about, or we don't talk about in polite circles. And so that's what gets interjected into my patient-centered focus with BACPAC.
So one of the things that we talk about, and I think Dante and Dr. Naomi, you mentioned it, is the role of patient advisors. and it seems to me that that's also one of the unique things about BACPAC. Obviously, I'm not an authority on all the research going on in science, but it seemed to me like this topic of having patient advisors and patient input to the research is unique to BACPAC, or maybe semi-unique, or maybe better, not popular in the industry. Is that true? And also, what do you see the benefit for having patient advisors?
I mean, every good new idea you have is kind of an old idea, right? So I think partnering with people to do better research has been around in various forms. Certainly partnering with community, you'll hear terms like community-based or community-partnered research that exists for community-level interventions, right? And so a good example of that was the pushes to do more colorectal screening, getting people to be comfortable thinking about colonoscopy by training your barber to have that conversation. And people actually started to do that with prostate cancer screening too, right? So you're getting your cut and your barber, your well-trained barbers, talking about, the NBA finals, and then they switch up and say, hey, by the way, you know about colon cancer. And that's been really effective, right? And that was one of those partnerships between researchers and community members. I do think that what we're doing is unique for the thing we're trying to address. We have collaborators and people that we work alongside here at the university that are doing this in other similar populations. So actually we are doing this ROSA's project now, BACPAC. That's not my acronym, by the way, so I can't take credit for all of them. That's Dr. Kemi Doles, but she works with Black women around endometrial cancer, right? So similar concept. But what's interesting to me is in medical research, even in medical care delivery, we don't do the thing that business people do, right? Like, and I say this all the time, Ben and Dante have heard this a million times, but you don't open a business in a neighborhood of any type, coffee stand, t-shirt store, without understanding what the people want and need, right? You don't just get an investment to open your doors and then just start selling coffee. Certainly not going to open that store next to another coffee store. You do your research and you understand where the need is and how to serve best. And that's not been required in medicine. I hate the term. We sit in the ivory tower and we pontificate. It's my favorite thing to have in medicine. Why do you think Black men have? It's like, have you talked to any Black men recently? Like, they may have some thoughts. And so that's been really great for us. What I also love is a trickle down effect, man. Some of the things that we say in our room when some of our collaborators are there that do different type of work and they hear it. And then all of a sudden, 2 years later, I'm hearing someone else, talking in their lane, and they're using our concepts. Clearly, the way they think about the problem has been really influenced by us. So it's such an important presence to have Black patients in the room for us to really demonstrate the power in the room. I also love how different everybody is in the room, because sometimes when people look at this problem, they just say Black man, boom, right? Just like one category, right? And you guys know what I'm talking about. All the different personalities, all the different walks of life, that all has to be represented when you think about the problem. So, yeah, I don't want to take credit as like Dante and me and Jenny and our research team, we're doing something revolutionary, because it is old. This partnered approach been around since at least the 80s, like in a formalized academic context, right? But yeah, I think we're doing it different, right? I think that's what makes it a little bit more modern, especially applying it to big clinical trials, which is really our goal. That's going to be different.
Thank you. So, Dante, let's tell us a little bit about this virtual research community.
Yeah, so it's basically a community that consists of like collaborators, researchers, patient advisors, and they're connected, throughout the country, hence virtual. And they each kind of advise or have input on various activities and studies, for BACPAC. And so it's just a way of keeping everybody sort of, connected. And there's opportunities where they can provide direct input on, some of the surveys or some of the cancer research that BACPAC is doing. They also can participate in webinars and educational content that's on our website. And yeah, they help us connect with other community-based organizations, other researchers. And so it's kind of like a big collaborative, and that's pretty much what it is. Yeah.
But how many people are involved in it so far?
Okay. So I'll let you answer this, but it's like, I think it's over like, we got invites, or we sent out invites, and we got a huge response. And then he was concerned that some of them were bots. And then because it was like 2,200, 2,400 people. And he was like, oh man, those are bots. And he was like, I'm going to check. And then I believe that they checked and there weren't. So it's a pretty big network. It's up there, like between 1,500, 2,000 people who are involved. And we keep in touch with them via, web, internet, virtual means, those type of things. So it's a pretty big network that's associated with BACPAC that helps drive our work and our research agenda, and just to stay connected.
Yeah, it's a big group, over 2,500 people, over 1,500 prostate cancer survivors. So it's a big group.
Big group.
And, I still worry that the people are not, that we have some bots and not everyone is real. 'Cause
Right.
it's an internet-based group, right? But I'll tell you, Dante is interviewing people from this group. So, what we wanted to do was have an audience of people that were willing to lend their voices on their experience to kind of supplement what we have in our smaller group, the 20 men or so that, 25 men that come to Seattle and work with us and jump on Zooms. And so we put out a request to do some interviews of people that were not part of our advisory team that were in the virtual research community. And according to Jenny, even though AI is really good, Dante has talked to some real human beings from what we can tell. So it's really exciting that we've had an opportunity to expand BACPAC to include, this virtual component.
Yeah, I think that's a really exciting part of what we do. And I forgot to say this earlier, but just for full disclosure, I am one of the patient advisors on the GEMS study, just to put that out there. So I'm not just doing this interview as an interviewer. I'm doing this interview as a participant and also a patient survivor. So just to make that clear to our guests. So some of my thoughts may be biased by my experience. And these guys are good guys to hang out with. We have a good time together whenever we get together.
Very good
It's pretty fun. Yeah. I was surprised when I actually got the invitation from you to join the GEMS group. I was like, okay. But I've learned so much since I've joined that group, and the sessions we have, the lectures and the training to be a patient researcher has been eye-opening and actually mind-blowing at times when I think about it. So what are some of the events that BACPAC supports, and what events do we have coming up that maybe our listeners and our viewers could also get involved in?
Yeah, so our group, the gentleman on this podcast today, plus about 25 more, maybe 30, get together once a year to just do the work, right? Because of the way we formed and where everybody's all over the country. I guess we haven't said this, but we got brothers coming in from Detroit, North Carolina now, Dallas, Austin, Texas, horns down. So we're from all over. And as a result, it's good to work in person at least once a year, right? And there's a call out for us to maybe even do it more than once a year, maybe twice. So that's a working meeting for BACPAC, and that's kind of internal business. On October 4th, we're going to have our symposium. That's open to the public. We open the cancer center doors. Everyone from our team is out there. And that event really is to do what has become something that is a request of the BACPAC advisors, right? You guys say we got to get the word out pretty much every time we meet. We have to get the word out about prostate cancer, about screening. And so we really want, and about the research we're doing, like what we're learning. So we want to use the symposium to do that. So we got a date. We're partnering this year with Zero, a big, advocacy organization. We got a really incredible slate lined up. You're going to get to hear from everybody in the group in some capacity. So we're looking forward to building community and educating at that event.
And that's going to be at the Fred Hutchinson Cancer Institute?
Yeah, and be on the Fred Hutchinson Cancer Institute. But it's a hybrid event. So when we go live, maybe we can share the link and the QR code to be posted along with this episode. But you can sign up for those that are not in Seattle or can't make it in person. There will be an option to hop on the Zoom and at least participate as you can.
Is it limited to just the United States, or people in other countries can register?
We had one person from one international participant last year, so we have capacity to have another. Time zones might make it tricky.
Okay.
I know every time I call family in Ghana, they're like 7 hours ahead. So,
Yeah.
there might be
Yes.
some limitations there. But yeah, all are welcome.
Yeah. So we talk about the research, we talk about the patient advisors, we talk about the virtual research group, we talk about the symposium that's coming up in October. Is there any other way that people can get involved with BACPAC? I mean,
Yeah, well,
we're not a membership
we're not a
organization where you
membership
have dues and stuff like that.
Well,
So
no.
how could people get involved?
So I think the two ways to get involved. Number one, if you want to have your advice, your experiences, your knowledge be part of the prostate cancer research apparatus, if you will, ecosystem I said earlier. I need to come up with a simpler word, but you can sign up for the virtual research community. We send surveys, often paid surveys where your voice can be heard and you can share your experience. And that goes to medical research that informs what we do next. And certainly, as I said, these interviews that Dante is doing are paid interviews, or you get an opportunity to share your experience, and we demonstrate how much we value your time in that endeavor by providing a small fee for that, consultant fee, if you will. So the virtual research community is a great way to get involved. Number two, if you're a survivor and you want to be on one of these teams, email us. When we started, every time we had a project, I'd have to email Ben. Hey, Ben, we got an idea for you. Poor Ben felt like he had to say yes to all this work. And now we get to spread it.
I had to email Ben.
Now we get to spread it around. So Grantley, you said, I'm surprised you asked, but you at the symposium, you're like, if there's a project, I'm willing to participate, and there's always a project. So there's a good way for people to become advisors. And then the third, and this is a shameless plug, and hopefully you can share the link. The BACPAC team we're doing a walk, run, bike ride event here in Seattle as part of Obliteride. That's going to call attention to our mission. It's going to help us raise some money, and a great way to be in community, to be active, and to demonstrate the power of being a cancer survivor, a cancer researcher. I'm really looking forward to getting the group together for that event and to show out, as they say. I think we'll have some BACPAC swag for the team, and we'll be loud and proud as we advocate for better prostate cancer care for Black men. So be on the lookout for that too.
That's a great one. And the website is obliteride.org, obliteride.org. And our team is called BACPAC, BACPAC, and you can donate to that. Three of us already signed up for that, and I already had my injury, so I know I'm going to do really well. My chain came off my bicycle the other day going up a hill.
Oh, sorry to hear that. Yeah.
My foot landed on the derailleur.
It's not good.
But I'm doing good. I'm looking forward to that. That's gonna be fun. So as we wrap it up here, our time is coming to a close. As we wrap it up here, I really want to thank you, gentlemen, for being here. But is there any closing comments that you would want to share with our listeners, or any words of encouragement? Let's start with you, Ben, and then we go to Dante, and then we have Dr. Naomi close it out.
For me, it's always I'm grateful and to be a part of the community. It is many days for personal reasons or personal health reasons that the folks in this community have given me that to move forward and not be so self-centered, so to speak. I still have this overinflated ego, and I wear hats to try and keep it in check. But the reality is that it is BACPAC at this point that even from the virtual standpoint, that has given me greater hope for all of the things that I wanted to see happen in my lifetime from the health community. I know that prostate cancer is just one thing, but it's one major thing, especially for African American males. And I'm just glad to be a part of it.
Yeah, I'm echoing some of those sentiments as well. I'm also glad to be a part of it, and thank you to you, Grantley, for having us here today, and also thanks to Yao and Ben. Ben was like my number one guy. I had a lot of partners but I reached out to Ben for everything, and so I'm grateful for that. And hopefully, I would say, hopefully we have a chance to connect with, Black men out there, and that they reach out and be a part of this, because I really believe that your voice matters and your experience matters, and you can really help us push the work forward. I think that this is a truly good organization. It's really good work, and I'm proud and excited to be, a part of it. I think it's a part of my own journey. And I think it's great. I have the opportunity to work with tons of patients, speak to a ton of men, and learn a lot from them. And so for those who are watching, listening, hopefully you can be a part of that experience. And we hope that we have the opportunity to connect with you and kind of address this issue, because prostate cancer among Black and African American men is a heavy disease burden. And we want to make sure we have the chance to address it. So that's all. And thanks for having us on today.
I echo what Ben and Dante have said. This experience has been an incredible one. It's been a fun ride. One of the things that I love most about this is the community we have, real friendships, right? The first time you met Ben, you put your hand out, nice to meet you, sir. It's a little stiffer handshake. You're still feeling each other out. You're grateful for the partnership, but it's not the same as when I see Ben now and I give him a big hug, and, it's just, there's a warmth there. There really exists. There's a respect there that's really hard to put into words. And so, I want that community to grow. Selfishly, I want others to have that experience, other survivors who want to make a difference, to know that there's a space where we can help you change what you don't like about the way that that prostate cancer care is being given or approached. So I think that's my final words. If you're sitting at home and you have a long list of the things that we're doing wrong in healthcare with regards to prostate cancer, there's a place for you to share that list and try to make things better.
And our website is BACPACnetwork.org, BACPAC network.org. And you can see the virtual community there, some of the work that's being done. You can also sign up, as we said before, if you want your voice to be heard, if you want to communicate with us, you can see it through the BACPACnetwork.org. Thank you, gentlemen, for your time. Thank you for here today. It's a great discussion, and I appreciate you. And thank you for giving us the hour of your time to share with our audience.
Yeah, absolutely.
Write us at realhealthblackmen@gmail.com. realhealthblackmen@gmail.com. To support this podcast, go to buymeacoffee.com/realhealthblackmen. buymeacoffee.com realhealthblackmen. And to become a corporate sponsor, send us an email.